Osteoporosis. Signs and symptoms of osteoporosis.
In the early stages of osteoporosis, there is usually no pain or other symptoms. Once the bone have been weakened, you may have the following symptoms. Collapsed vertebra, which may initially be felt or seen in the form of severe back pain caused by compression fractures in the spine. But sometimes these fractures cause only minor symptoms or no symptoms at all. Loss of height over time with stoop posture, kyphosis. With normal aging, everyone has some loss of height. However, a loss of 1 inch or more is significant and may indicate osteoporosis.
Causes of osteoporosis.
Age and osteoporosis. The rate of osteoporosis increases with age. Osteoporosis can be seen at any age but is much more common in people getting older. Sex and osteoporosis. Women have a higher rate of osteoporosis than do men, but both men and women can develop bone loss, family history and osteoporosis. A person with a parent who had osteoporosis is at increased rate of developing bone loss. Race, ethnicity and osteoporosis. People of all race and ethnicity develop osteoporosis. However, African Americans tend to be a lower race than other groups. Disease and condition. A number of diseases and conditions are linked to an increased rate of bone fracture and osteoporosis. Most clearly linked are results from a bone scan showing you already have osteoporosis or lower bone mass. Breaking a bone after age 50 is another important marker for osteoporosis and is linked to an increased rate of breaking another bone later in life. For a number of reasons, rheumatoid arthritis and diabetes also raise the rate of breaking a bone. If you have any question about how your medical history affects your bone health, talk to your doctor. Patients like steroid and certain cancer chemotherapy an important part of treatment of disease, but they can also cause bone loss. People who need this medication should take them as direct and should also talk to their doctor about ways to help protect their bone. Physical activity and osteoporosis. Exercise is one of the best ways to protect yourself from osteoporosis. Weight-bearing exercise that work against gravity like walking, cramping and weight training help maintain stronger bone. Exercise also help prevent other diseases such as heart disease, stroke, diabetes, obesity, and colon cancer. Postmenopause hormone and osteoporosis. Postmenopause hormone can contain different hormones that are similar to the female reproductive hormone, estrogen and progesterone. After menopause, a woman's body stops making those hormones in large quantity. Estrogen is especially important in osteoporosis prevention because it can reduce bone loss and increase bone density. Topical smoke and osteoporosis. Smokers have a high rate of osteoporosis than do non-smokers. Smoking may work in several ways to increase bone loss. Weight and osteoporosis. The rate of osteoporosis is higher in thin people with small bones and lowest in heavy people. Heavier people have a lower rate for several reasons. The extra fat most heavier people carry increased estrogen level put weight-bearing stress the bone and can act as cushion in case of a fall. Diet and osteoporosis. Diet can play an important role in bone health. Too much vitamin A in form of retinol can increase the rate of osteoporosis.
Cure of osteoporosis. Prescribed drugs such as biphosphonate is suitable for both gender. Side effects of biphosphonate causes nausea, abdominal pain, difficulty in swallowing. Estrogen is another medication specifically for women, but it can cause blood clotting, breast cancer, and heart disease. 3 factors essential for keeping your bones healthy throughout your life are: number 1, adequate amount of calcium; number 2, adequate amount of vitamin D; number 3, regular exercises. Men and women between the age of 18 and 50 need 1,000 milligrams of calcium a day. This daily amount increases to 1,200 milligrams when woman turns 50 and men turns 70. Good sources of calcium: low-fat dairy products, dark green leafy vegetables, canned salmon or sardines with bones, soy products such as tofu, and calcium fortified cereals and orange juice. If you find it difficult to get enough calcium from a diet, consider taking calcium supplements, but too much calcium has been linked to heart problems and kidney stones. The Institute of Medicine recommends that the total calcium intake from supplements and diet combined should be no more than 2000 milligrams daily for people older than 50. Vitamin D is necessary for your body to absorb calcium. Many people get adequate amount of vitamin D from sunlight, but this may not be a good source if you live in high latitudes or if you regularly use sunscreen. Exercise can help you build strong bones and slow bone loss. Exercise will benefit your bone no matter when you start, but you'll gain most of the benefits if you start exercising regularly when you're young and continue to exercise throughout your life. Management of osteoporosis. Moist hot packs and transcutaneous electrical nerve stimulation can relieve pain of osteoporosis patients. Thus, the osteoporosis can be rehabilitated. Avoid smoking and excessive alcohol. This is because smoking can lower bone mineral density, whereas alcoholic drinks can reduce our body from absorbing calcium properly. Lastly is to maintain good nutrition and exercise regularly.
This is the end of our video. Thanks for watching.